This is Orsi, official old guy at oldguytalkstome.com, a podcast dedicated to helping older guys create kick-ass lives for themselves and those that they love. It's for women too. Each week, I bring you a special guest to help you create that life that you imagine for yourself and those that you love. We talk anti-aging medicine, personal growth, relationships, and sex, vices, and other topics that many don't want to talk about but need to. Just because you're getting older doesn't mean you have to be old. Also, if you want to know 3 ways to get laid more frequently without begging, go to oldguytalks.com and opt in. When you do, you're going to get my informative video on 3 simple things you can do to get laid more frequently without begging, so you don't have to turn in your man card. And ladies, you may want your man to know these things, because I think you'll like it too. Additionally, you'll be notified weekly when a new podcast episode is ready for you to consume. Periodically, I will share with you other stuff that will help you create that life that you want for yourself and those that are important to you. Don't want to miss anything? Be sure to subscribe, share, and review this podcast.
This is information only. Consult with an appropriate professional before starting any program. Do not be stupid. You are responsible for your own shit. The old guy is a capitalist and not a socialist weasel. He will be promoting stuff here and may be compensated. You can rest assured the old guy only promotes stuff he uses. You may have different results.
If you're looking to get ketones designed by world ketosis expert Dom D'Agostino, PhD, then go to www.oldguytalks.com/keto. And when you do, well, you're going to get some special treats about how you can take advantage of all that energy you get when you are in ketosis. This is Orsi, official old guy at oldguytalkstome.com, a podcast dedicated to helping older guys create kick-ass lives for themselves and those that they love. And part of that is, this whole aging thing, you want to try to slow it down. You can't turn it back, but you want to slow it down. You want to slow down the effects. And today I have Dr. Grace Hameister. She's a chiropractic, integrated medicine, and nutrition specialist. She has an undergraduate degree in psychology and a double degree in biology. She is a licensed and board certified doctor of chiropractic medicine and advanced cold laser specialist. She has 20 years of integrative medicine experience, including functional medicine and chiropractic care. Her practice is built upon the unique perspective of being a geeky scientist and an elite athlete. And we're going to talk about that. This crazy combo has brought her to live and work in the world of celebrity, high-powered executives, musicians, innovative thinkers who are having a positive impact on the people in the planet. She's also a former Olympic-level rhythmic gymnast. She's a world champion water skier and post-grad assistant performing cancer research in immunology. She has an intimate knowledge of how the body can function at its best from the cellular level on up to full body systems, integrating system integration and repair. So welcome to the show. So today, so my first question is I always like to get this out there. What is the most important thing you've done today?
What's the most important thing I've done today?
Yes.
I helped a good friend of mine who threw her back out to find out the best doctor to go to deal with her issue.
Okay. Well, that's good. That's nice. It's nice that you were able to help someone out.
Yeah.
That's wonderful. That's wonderful. So how did you get into this space, into this chiropractic, functional integrative medicine space?
Yeah. Well, it all started, honestly, when I was a kid. I was an athlete. As you mentioned, I was the first Olympic level rhythmic gymnast in the state of Wisconsin. And I traveled extensively throughout the country because of, competing at that level. And when I would see injuries happen, which is inevitable in any high,
sure,
any sport like that, at that time, surgery would just pretty much take you out, So I've like, there had to be a better way than only going for surgery to do things. What can you do to optimize the body? What can you do to stay healthy and ahead of the curve? And so from my gymnastics days, that fielded into my professional water skiing days, where I saw even more injuries, honestly. You know, when you're getting towed 30 to 40 miles an hour behind a boat, you tend to crash a little harder than you do when you're just throwing a ribbon in the air, you know? So, at that time, I was competing, and I was competing in doubles, which is kind of like pairs ice skating with a guy and a girl doing lifts, right?
Sure.
Well, behind a boat, the way this works is that the guy was wearing a belt, and the boat and the rope was attached to his belt. So his arms are free and he can do lifts. And we did this whole, routine. Well, he hurt himself 3 weeks before the World Championships, and we decided to go to the Bud Pro Tour anyway, which is where he was competing as a jumper. Mm-hmm. And he had lost his air position sense doing a jump and landed on his neck and snapped it forward. Couldn't even put his first two fingers together to make an okay sign. And I now know is a C6 nerve root, but at the time we had no idea what was going on. And we went to the Bud Pro Tour, and there's a chiropractor, a physical therapist, and an MD working at each one of the sites because it travels, mm-hmm. right? And the chiropractor worked on him. 2 weeks later, he was feeling fine, and 3 weeks later, we competed and won. So
that's amazing.
Yeah. So that opened up my eyes to what this profession can do. I had no idea. Growing up in the Midwest, in the middle of the country, we're not as exposed to some of the more technologically advanced options for things. And the old school way of doing stuff is still very much the way of doing mm-hmm. stuff around here. So once I was exposed to that, I was working at SeaWorld, and my boss there told me that, there's this chiropractor who was close to where I was, because I was at this crossroads of where I wanted to go in medicine. I wanted to always be doing something in medicine, but I didn't know what. And I decided on maybe going the dental route, and I worked in a dental office. And I was just like, oh my God, I can't do this for the rest of my life. There's no way. I was there for 2 hours, and it seemed like I was there for 2 days. And I just knew, like, okay, I can't do this. So I talked to my boss, and he said, go check this guy out. And sure enough, it was the same guy that fixed my chiropractic, or that whole thing that happened with the water skier. Mm-hmm. That's the chiropractor who fixed him. So as soon as I saw him, I was just like, what? You? Like, and I know you. And I told him the story. And since then, he's been one of my greatest mentors. His name is Dr. Terry Wyman. He's in Thousand Oaks, California. And he opened my eyes to what science and medicine can do when you combine optimizing health and nature. And that's what I've been doing ever since.
Yeah. It's amazing how things have progressed quite a bit. So one of the things that you're a specialist in is in cold laser therapy. Yes. Can you tell us a little bit about it, and what are the uses for it?
Sure. Well, first of all, most people don't know this, but laser actually stands for something. It's light amplification by the stimulated emission of radiation, LASER. Mm-hmm. And a true laser, the light comes out of the aperture in specific beam format so that it'll go from here to the moon and back in a straight line. And that is what makes it super powerful for dealing with the body, because our body is made out of water, right? Mm-hmm. 70 to 80%
Sure.
water. So the light reflects and refracts off of our tissue, and it helps the laser to get deeper into tissue and to do things that no other technology can really do. And it has to be a very specific laser, though. Right. The one that I use is in the 635 nanometer range, and that range is the same as the life phase of a cell. So, for example, if you have a condition or let's just say injury. We'll just start with injury, right? The reason you want the right laser, here's the perfect example. At the Olympic Training Center in Colorado Springs, there was a cyclist that was he crashed, went on the course, and he had really bad road rage. Where did that come from? Road rash.
Road rash.
He probably had road rage too from falling. He was probably pissed off.
But I'm sure he was raging.
Yeah. So anyway, my apologies. Road rash, and he was taken to the doc there, and they just gotten a laser, and they're like, oh, let's use this laser because the laser is supposed to help you heal like Wolverine, basically, where it gets into your body at the cellular structures and helps the repair to increase rapidly. So they use the laser, but what they didn't know is that the laser that they used was in the 800 nanometer range, and that actually helps to increase bacterial growth. And they almost gave him sepsis, and he almost died because he was overcreating bacteria instead of it being killed, which is what the one that I use has. So that's why you want to really know what you're working with when you're dealing with lasers. They're very specific. The science behind them is very specific, and the outcomes that you can get with them can also be very specific.
Yeah, I mean, because there's some lasers that, I mean, they're used for cutting, they're used in surgery, they're all also, so it's actually the particular laser is very important, you know.
Correct.
So,
Yes, and that's considered a catabolic laser, which means that it breaks tissue down. That's why you see the smoke coming out, or like we get with eye surgeries and making blood stop, things like that. Whereas mine is an anabolic laser. It makes things repair. So it's called cold laser because you don't feel any heat or anything like that. It's just a repair mechanism.
yeah. So what type of things can you treat with, what would be common things that you could treat with a cold laser?
It's very, very effective with pain, especially joint pain, joint mobility. The whole purpose of what this laser does is it decreases pain, decreases inflammation, increases range of motion, and it increases muscle strength all at the same time. So when you're dealing with, say, neck pain, TMJ pain, things where the joint's not moving well, I can actually increase the range of motion significantly to improve function and get the repair to happen so that you can throw that ball again, get back out in the world and do what you want to do. It's also really, really, really excellent for injury repair that has to do with pre and post-op surgery kind of thing. Any kind of scar tissue. It's fantastic for making the scar heal without seeing any kind of mark left behind. It's beautiful to use on people who have sustained third-degree burns because those are so painful, and touching you at all is difficult to have any kind of touching. This laser doesn't need to touch you; it just needs to have its light shining on you close enough to the area of interest. But again, it helps you to heal like Wolverine by getting the collagen fibers to grow. And it's one of the few lasers that also makes your collagen fibers, which is what makes up ligaments, to grow. So when you have a ligament injury, this is the thing that can help to repair that too.
Yeah. So actually, it's tendons and ligaments, I assume, both.
Yes.
Yeah, because I think a lot of people suffer with tears in their ligaments and things like that. Actually, it was kind of interesting that you mentioned the training facility in Colorado Springs, and this I don't know if you run across this Charles Summers. Have you run across him?
No.
He was the men's Olympic gymnastic coach for about 20 years.
Gotcha.
And I was listening to him, and he had an interesting comment about how people get injured when they are older. And he said that what happens is that people, when trying to get back into shape, don't realize that their muscles, it takes about 90 days to grow muscle, but it takes 210 days to grow ligaments and tendons in order to support that activity. So people are kind of all of a sudden, so their muscle growth actually outpaces their ability of the soft tissue to handle that stress. And that's where a lot of the injuries come in on people.
Yeah, that's true. That's true. Unless you can mitigate that with things like human growth hormone and nitric oxide.
Yeah.
And that,
yeah.
and I have ways to do that too.
Yeah, and so it was interesting just from that standpoint, because it was, now I lost my train of thought. Oh my gosh, I can't believe it. So let's talk about since we were it's kind of a natural flow. Let's talk about nitric oxide, because you mentioned that as part of the process. And
this is something. Healing. Yes, I've been connected with nitric oxide and its potentiality since my days in college. I did cancer research in immunology as an undergrad, and what we were trying to do is get a macrophage which naturally releases nitric oxide to help kill a pathogen. We're trying to get it to find a tumor, a cancer tumor, and just naturally release the NO there. So that's what I first started learning about it. And this was back in the early 90s when I was learning about that. But now the implications that I have for how the body can repair, how you can slow down the aging clock, and how you can build muscle at any age, healthy muscle at any age with ligament integrity, as you were just discussing.
Sure.
is by having higher doses of nitric oxide. And that, in conjunction with human growth hormone, both of them decrease over time.
Right.
That's one of the things that we lose as we age. Cortisol increases, which is one of the our stress hormone, right? The fight or flight.
Mm-hmm.
So when cortisol increases in your body, that starts to degenerate muscle and ligaments and all that kind of stuff, as well as
Mm-hmm.
brain fog and all these things. So keeping cortisol down, you do that with exercise. Well, when you're getting in your older ages, it's harder to get out there and do high intensity interval training without hurting yourself. So what we do now is use blood flow resistance training. And this is something that is brand new that I have just been coming in contact with more and more. It was designed by originally the Olympic team in Japan. And when the guys started using these bands, it's just these bands that go on your arm, right?
Mm-hmm.
And it restricts blood flow. But what that helps to do is create a chemical signal in your brain to produce more growth hormone and to also mitigate nitric oxide. Nitric oxide is when you feel that you're getting the burn, right? That's when nitric oxide increases in your body to give you global circulatory amplification. So you're actually growing more tributaries too. And nitric oxide helps with brain function. It helps with sexual function because tissue dilation. Sure. It helps with keeping the muscles strong. It helps with gut function. It's extremely important for the gut. So if you can do something like wearing a B3 band, which is really easy to do for 20 minutes a day, when you're just walking around or playing with the dog or doing your normal activities, you can actually create these chemical cascades that build muscle naturally, increase nitric oxide production, and increase human growth hormone at older ages. We've got guys that are using this in their 70s who just increased their biceps by 2 to 4 inches. So this is something that is extremely valuable in an aging population.
You know, now with compression, good quality compression wear, would that do the same thing or?
No, absolutely not. And the reason being, you don't want to be compressing to the point that you're damaging tissue, which is like what a tourniquet would do, right? Or stopping arterial blood flow. So you want that venous and arterial blood flow both. And B3 bands are multi-chambered. They're the only ones in the market that are safe to be used like this. It's kind of like with your fingers. If you put your fingers around your arm like this, there's space between, right?
Right.
So when the bands inflate, they inflate, but there's these spaces so that you can get that blood flow coming in and out. And the studies are showing that not only are they the safest, but that creates the best outcome as well.
Okay. And that, what was that called? You had a specific term for that. What's that called?
Blood flow resistance training with B3 bands.
Okay. Well, that's very, and
I'll give you the links for that too. It's a really.
And we're going to have, by the way, for everyone listening, we're going to have all the links to work with Dr. Grace and find out more about her and all that are going to be in the program notes. So you don't have to worry about getting that stuff because we just always put it in there so it's easy to access and you're getting it. You don't have to worry about spelling things correctly when you're trying to get a URL down, which is for me, which sometimes is an issue. So as we're kind of talking about this whole healing thing, let's talk a little bit about hyperbaric oxygen.
Sure.
And I mean, we hear about it, you see it on TV and things like that. And some of it seems very exotic. And also, I want to talk about accessibility. Because it seems like that would be like something like, you think you have to go into some sort of a super science center to get that done, behind major closed doors and things like that. So talk a little bit about that.
Well, honestly, that's the beautiful thing about tech now and medicine. Things are getting smaller and more accessible. And as we, progress through time, we're creating better machines that are working more efficiently and with greater purpose. So hyperbarics has been around for a long, long time. And originally it was used mostly to help people who are, out in the ocean diving and would get the bends and would need to have that reversed. But as more and more studies were done, hyperbarics has been really, really effective for a lot of things, including stopping the progression of Alzheimer's for going as quickly. It helps with Alzheimer's and dementia tremendously. It helps with decreasing overloaded toxin states, especially heavy metals. It helps with pain a lot, especially when you're dealing with open wounds and the repair process, like post-op kind of stuff. Because what it's doing is actually forcing oxygen into your tissue. And by doing so, a pathogen or a bad guy cannot grow in an oxygen-rich environment. So the more oxygen you have and more oxygenated you are, the less propensity you are to have these other disease states. So respiratory issues, excellent for that. It's also excellent for brain repair in general, like for concussions, things like this. So any kind of sports injury, or if you've had concussions in the past, it's a great way to help to give yourself some repair.
Okay. Typically for some of these things, I know it's highly variable, but how many sessions does someone need for, let's say, maybe some tissue repair or something like that?
Yeah, well, generally we want to start about 6. That's a pretty standard one. And to go back to your last question too, it's not just the hospital system that has those giant chambers that you sit in. There's a company called OxyHealth now that makes them portable. So it's basically like the size of a refrigerator, maybe a little less and a little bit longer, and you just zip up into it and lay down and meditate for an hour, and that's your session. So it is a lot more accessible. You just need to Google practitioners that have the portable hyperbaric chambers, and yeah, it takes about an hour. So just go in there with some music or ready to take a nap or whatever, and let the machine just do its work and reap the rewards from it.
Well, okay. I did not realize that those were just more readily available these days.
Yeah.
For people to use. Did you know that there are 76 additives that have been approved by the FDA that can be added to wines? You want a wine with shit in it that may not be good for you? Well, there is an option for wines that have been produced naturally, organically, that have been tested, that have no sugar. And when they don't have any sugar, that means that they're ketosis and intermittent fasting friendly. These wines have been produced with a great deal of care on small farms and are available to you. How do you get them? Find out by going to www.oldguytalks.com/dry farms, all one word with an S, and find out more. And with your initial order, you can get a bottle for 1 penny. That's right, a bottle for 1 penny. And they taste great. They taste great. Don't wait, don't hesitate, don't procrastinate. Get those wines now. Now, when let's kind of switch gears here a little bit. I want to talk a little bit about gut health, because I know you're really big on gut health.
Oh yeah.
Why should I care about gut health?
Well, if you like your brain working, you need to care about your gut working too. The gut-brain axis is a huge topic in medicine now, but it has been for decades, and especially in natural medicine. Your gut contains 70 to 80% of your immunology and your neurology. So if you are trying to not get sick, if you are trying to fight off anything, if you are trying to think better, have better neurological and physiological output, you got to start in your gut. So people that have chronic conditions that keep popping up, like skin conditions and autoimmune diseases and a lot of different kind of like the real hard stuff that just doesn't seem to want to go away.
Sure.
9 times out of 10, it's because your gut isn't functioning properly. Either you're not eliminating daily, you're not absorbing your nutrients enough, you don't have a good stacked microbiome, and you're maybe super acidic. All of these things add to a lot of the disease states that we're seeing now that become a bit more complicated.
Yeah, I imagine it also increases your inflammation too in general if your gut.
Absolutely, 100%. If you have any pain of any sort, fibromyalgia, joint pain, knee pain, if you're not using everything you can to stabilize your gut while you're treating those little areas like that, you're just going to keep running in circles.
So how do you determine your gut health? What's the process of doing that?
Well, in functional medicine, one of the ways that I go about it is through objective testing and also subjective information. So, excuse me. So first of all, I like to start with a food journal. I want to see what your normal eating patterns are, including, and what I always like to say is whatever you put in your face. So I want to see what you eat, the time you eat it, and what the general brands are. Like if you had a bag of chips, what were they? Would you a bag of Doritos, or did you have some organic potato chips? Or, you know, I need to know the basis of what you're doing. And then on top of that, there's also a company called Genova Diagnostics that I go through as a physician. And I send you a kit and you do a stool sample for me. And it gives you a 20 to 30 page report of all the things that are going on in your gut.
Mm-hmm.
Everything from inflammation to tight junction issues, to absorption issues, to is your microbiome, do you have enough probiotics? Do you have enough good bacteria? Do you have too much bacteria? Do you have an inflammatory markers that are too high or too low? It goes through all of these different things. So it gives me a good indication of the function that you have in a very, very comprehensive way.
Yeah. So, and the treatment is basically a change in diet, or is it supplements, or what would be treatment to get your gut healthy?
Yes and yes. Yes and yes. You know, we have to start you got to eat. Everybody's got to eat. You got to eat and you have to stay hydrated. And so the number one thing that's going to help repair anything with a dysfunctional gut is start putting things in it that'll serve your body rather than break it down. So starting with the food, yes, food and what you drink. And then of course, things that will be an anti-inflammatory diet, things that will be leading towards decreasing the acidity levels, things that will help to stabilize your gut over time. And then, yeah, definitely supplements that are pharmaceutical grade that you should get from a physician, not just Google something on Amazon and think it might work, because you could start doing stuff that would be counterintuitive for what your gut really needs by just saying, yeah, I've kind of got those symptoms. Let me try that. You know, I can't tell you how many times I had to work with people to reverse the let me try that.
Sure, sure.
Yeah.
Well, yeah, I think the whole food thing is very interesting. Obviously, during COVID, we were all kind of inclined maybe to do things that we wouldn't have. We generally don't buy food in cans, but we thought, okay, well, maybe a little, so we started to get into a little prepper mentality. We didn't go crazy, but we bought some canned food, a chili one in particular, because it's got meat and beans, and that if you have to, it'll last you a long time. But it was good till 2023.
Yeah.
What food without refrigeration?
Right. And people don't recognize that. That's so true. You know, it blows away. If your food can't disintegrate, it's not food. It's a food-like product. It shouldn't last that long. You're right. Yeah, that's crazy.
It's more like embalming fluid than it is actually food. I know that we went to a place that has actually in Iceland, because it's so isolated.
Right.
They don't import anything, so they don't have anything. There really isn't anything there are very few things are canned in Iceland, and an orange will cost you $5 too.
Sure.
But most of the food is locally sourced and locally made. So you will go into a little town and all the food would be fishing there, and the bakeries there, and all, everything is right there. And it's interesting how you can eat a lot and still lose a lot of weight, especially if you're
called
eating
optimal function. Yeah. That's supposed to be.
Yeah. Instead of using stuff that has all sorts of chemical names on it that you can't pronounce.
Exactly. I think one of the best pieces of advice I got was when I was at the Olympic Training Center as a kid. It stayed with me all these years. It was our nutrition expert told us something that Jack LaLanne had said back in the day. And he said, if God didn't make it, don't eat it. Yeah. Keep it simple. Totally true.
No, I think there's a lot to be said to that. Right now, a lot of people are into keto and intermittent fasting. Why don't you tell us what your perspective is on that?
Of course. And before I do that, if you hear more squeaking in the background, I just got a new puppy and he just found his squeaky toy.
I just,
So,
it's all
yeah,
good.
of course he did during the podcast. Sorry. He's 5 months old. So if I can catch him when he comes by, I'll try to get that to stop. But yes.
By the
Yeah.
way, Dr. Grace, it's not the worst thing. There were times I used to do my podcast sitting outside, and nothing worse than having your neighbors have the landscapers come in with the blower in the middle of your interview.
Oh, perfect. That's really perfect.
So a little squeaky noise in the background.
A little squeaky noise. Okay, yeah, right.
That's
I'll take
nothing.
I'll take it. Exactly. So keto and intermittent fasting, I mean, they're obviously like two completely separate ends of the spectrum of nutrition. One is metabolic and helping with metabolic activity, and the other one is to get the cell structure and gut to change too. So intermittent fasting is an excellent way to reset the gut function, to increase your body's ability to burn fat as well. And as we age, we don't need as much of the caloric intake either. So it's something that is effective for that. And when you think of fasting, a lot of people start to think of like Gandhi, and how he went for days on end without eating.
Sure.
When protests, this is not what we're talking about. There's still nutrition involved. There still is food involved, preferably really good food that increases the gut biome, like probiotics and kefir and fermented foods. Those are excellent for improving gut health. But when we think of fasting, just think of basically having your last meal at dinner time around 6 p.m. And then you're not eating again until the next day around 10 or 11 in the morning. And now you just fasted. It's not that hard. Yeah.
It's actually, I've been doing it. It's actually very easy. And for me, I really don't eat till about 1 o'clock anyway. So it's just kind of like I have some water and things like that, but that's about it. But
yeah, you start the day slowly with liquids and liquid nutrition, and then you get, you're a good balance of well combined food and high quality proteins, that be it plant-based or animal-based, and then you stop eating at around 6 or 7 at night and you're good to go.
Sure. Sounds pretty good. What about ketosis and things like that, keto diets and things like that? Let's talk about that a little bit.
Well, I'm actually not really an expert in the keto diet. I mean, the whole purpose of what that is to get your ketones to increase, which means that you're going to be burning fat, building more muscle mass. And I'm much more of a proponent of a paleo approach than I am keto. I'm the ketones and keto are two different things too.
Right.
And each one of them has their own metabolic pathway that I'm just not as it's just not my I'm aware of, but I couldn't really go into deep dive info with you on this one.
Sure.
as much as I can with gut repair and how to fortify that.
Okay. Right. So you have a telemedicine practice, correct?
I do. Yes.
Okay. So let's talk a little bit about how that works and how a patient would come into your practice
Sure.
in these days of telemedicine, and what they can expect in terms of tests and all of that stuff.
Yes. Well, my business is called Sane RX Longevity Institute. That's Sane is SAIN, and it's actually French for healthy and wholesome. And it also means sane to me. And so it was an easy way to kind of have a play on words, and RX, of course, prescription. So it's a more sane approach to a healthy lifestyle through nature first. And to get in contact with me, you can just get on my website and book a session through that. Telemedicine has evolved tremendously, especially since COVID. I have been a concierge doctor and a traveling doctor throughout my entire career. So I've never really had the brick and mortar kind of, office where you go into and see a doctor like that. In fact, I still have patients in California that call on me every once in a while. I've seen athletes, actors, entrepreneurs, the high profile market. And so in order to get in contact with me, you just literally just get on the website, and that's not a problem. As far as the things that we cover, I mean, it runs the gamut. Obviously, the hands-on work is a little bit more challenging because we're not doing it. However, the testing that is done is very thorough and is done either through blood spots, which we can do now. You can gain a lot of information just from a finger prick test and filling up blood spots, as well as urine testing, stool sample testing. And if we need to do full blood draws, we can do that as well. I also do some of my testing by just putting you through a variety of positions and taking a lot of diagnostic information as we are, doing our session to get to the bottom of what your needs are and to fix them.
Yeah. So, and you work with all ranges, ages of people and
Oh, yeah.
Okay.
Absolutely.
Okay. And you also do spend some time doing hormone supplements. Is that correct?
Yes. I'm not a huge, that's not the cornerstone of my business. Hormones. I'm more of the of pain reduction, tissue repair, optimal health, gut health, and sports optimization. So that's why those are the things that are more my niche. The hormones and hormone replacement therapies, I will test for them to make sure they're working properly, but to balance them out and to have like creams made and the natural approaches to doing that, I would refer to a colleague for that, because that's just not what I do on a daily basis.
Sure, that's pretty nuanced.
Yeah, I can't wear all the hats, Orest. I can just wear most of them. But, I'll help kick out some of that inflammation and keep cancer out of your body and keep your Alzheimer's from not coming up, like all the things that we can do to prevent these things. Those are my wheelhouse, but I can't wear all the hats.
Oh, wonderful. Well, Dr. Grace, as I mentioned, we're going to have all your contacts, all your email and your websites and all that in the program notes, and so that everybody can find you to work with you. It's been a very, very informative time that we had a chance to spend. I want to thank you for coming on the program. Any last words that you want to of advice or wisdom, or just an interesting story? Actually, I have to ask you a question. So somehow you are actually, there's two questions. I don't know. I forgot. So you're somehow in the Grateful Dead. You work with some of the old band members.
Yeah, I worked Bob Weir himself. Yeah.
Okay.
Yeah, I was like I said, I was a concierge doctor. So I would set up on site, on set, backstage, and I would create these backstage green room kind of things. And that was at the Fillmore in San Francisco. So I saw the band before they would go out and play and adjusted them and worked on them, took care of their food and all that kind of thing. And then then sat and watched the show. It was one of my favorite ways to work, was with musicians. That kind of got me my foot in the door with the high profile market. Another band was the guy I just had a conversation with recently on my podcast, Uncommon Medicine. And that is the lead for War, the band War. Yeah, they made the song Why Can't We Be Friends and Lowrider and all that good stuff. Howard, he's my guy, and I helped him before they went out in the gig, and we've been working together ever since. Yeah,
and those folks are so old that they need a lot of maintenance at this point. Nothing. I've been to see the Rolling Stones several times, and every time I go, the handicap seating is expanded.
Right, it's bigger.
and brought to you by Viagra and Lipitor.
Right. And Nitric Oxide and B3 bands now.
B3 bands, yeah, too. Yeah, and so all of that.
Yeah, those guys are athletes. People don't recognize the fact that musicians truly are athletes. I mean, they're out there doing their thing for an hour straight, and their cardio is up. They're stronger than you think, really.
Oh yeah, no, I totally. I mean, you can't dance for an hour
and sing
and sing and play an instrument.
Right.
Sometimes behind your head, and then the other. I mean, for any of you who think you can do that, go get a jump rope and try to jump rope for 3 minutes and see how far you get.
Exactly.
Probably not
Exactly.
very far. So, okay. So my last question, is, okay, so we all have these deep, dark secrets, things that we don't want people to know about us. And so we're just, so when you're like in the dark and whatever, what is something that people would be surprised about you, that you don't want people to know, but you really want to, you want to confess now?
Okay. Well, I guess I didn't want to do any photos or video at the time because I always knew I was gonna be Dr. Grace, but I bungee jumped naked. Yeah. I just graduated from chiropractic school. I went to Puerto Vallarta, and there's this place you can go there and bungee jump over the ocean. It's like 180 feet above the ocean. And the guy that ran the place was like, so if you go naked, you can go for free. I'm like, okay. But my first question was, I'm like, is there any cameras around? Are there? And he said, no, there's not. I said, okay, why not? And then, but here's what the funny part about it was. It was Sunday. So because it was the holy day, I wasn't allowed to go completely naked. So it was only half off, which was really kind of funny. But then I went back 4 years later, and I was with my boyfriend at the time, and he remembered us. And this time it was a Thursday, so I got full off that time.
Oh, okay. That, folks, is an interesting fun fact.
That's the best I can do. So
hey, that's pretty damn good. That's pretty damn good. So I was not expecting.
Not expecting that one, were you?
I was not expecting that one, and I'm glad I asked. So Dr. Grace, thanks again, and remember, we're going to have in the program notes where you can connect with her and find out more about, well, having some work done with her and getting yourself tuned up. So this is Oris, the official old guy at oldguytalkstome.com. Remember, it's all about creating a kick-ass life for yourself and those that you love. Until next time, thanks for joining me on this podcast. If you like what you heard and learned, then be sure to do 3 things. 1, subscribe so you don't miss the next episode. 2, share this with someone who may need to hear it also, and it may be your significant other. And 3, review it. Give me a good review. If you didn't like it, give me a bad review. I don't care. Just review me. And be sure to get my free video on 3 ways to get laid more frequently without begging. Opt in at oldguytalks.com. Don't be that guy that just takes in the information. Take action. Without action, you're not going to get the results you want.